Thanks, Donna. It is so great to see everybody. We had a wonderful morning this morning, a great networking opportunity, as was said earlier. Those networking opportunities were by demand, and hopefully the ability to cross-pollinate ideas will allow us to move forward together throughout the year and coming years and make good use of our time here together. I am really excited about this next panel. We talk a little bit about making this opportunity, the day that you all took away from your work and your lives, really worthwhile. And I hope that this panel is going to provide you with things that we will use in your personal life and in your professional life, and have that hallmark of focus forward, that as we look around the corner, we're going to be anticipating some things that are going to change or that are in the midst of changing right now, and learn about what we can do to improve the future. I'm Rochelle Goodwin, and I am part of the Benedum Foundation team, but it's been my pleasure to work with this group on Focus Forward for many years. And I want to make sure that our panel, this is the first year we've really done healthcare, so we're going to talk to some healthcare leaders here today, know a little bit about you. So let me just ask, by show of hands, who has been to a Focus Forward event in the past? Okay, and who's new to Focus Forward? Good mix, all right, welcome new folks. How many people would say they work in education? Okay, economic development, private sector, nonprofit, government. Okay, so as you can see for our panelists, we have a great mix of people, which is one of the special things about Focus Forward. This is an event that's free and open to the public, and we bring together people who have that intellectual curiosity and passion to make life better as they go back. And we really do, again, appreciate all of your time. We're gonna ask our panelists today to give us that useful information about how to take something away that we can learn and use, about pulling back the curtain on some things that you may know that not everybody else knows about healthcare systems and what's important to our lives. And when I say healthcare systems, I'm going to ask these folks to describe what exactly is that. What's a healthcare system? Because we know when we had the poll everywhere question, health came up big and strong for longevity. But how does health and longevity connect to a health system? How does that really translate in our everyday lives? And then we're going to ask to talk about and think about what we can do in our personal and professional lives to strengthen the partnership between our health systems and our own personal longevity in our lives. Clay did a great job this morning with Jen opening this panel up, and you were one of the panels that Clay called out as being one of the most important things to think about. So no pressure, but we're going to talk a little bit about not only those three things, but how health systems can really think about beyond the transactional, right? Beyond a fee for a service. And these folks are innovating. Excuse me in that regard. I'm not sure why we're whistling.
Yeah, okay, they got it.
Okay, so if you think about your long, healthy life, you probably either yourself think about getting to a doctor, or your kids that you're raising here in the state, or your parents that you're caring for. Those people, you care about having a long, healthy life, and where do you go for care? And is it just seeing a doctor, or is there more to that? Clay gave us about 5 things to think about. So we'll talk about all of those things today. Now, excuse me, I want to make sure that we start with the introductions, but I don't want to take too much time because we really want to get to what you have to say here. I'm going to start, Mike Grace. In your program it says Albert. Michael Grace is Albert today. Albert was, delayed in getting back on his flight, and Michael Grace is the Chief Operating Officer of the WVU Health System. But let me tell you just a couple other things about Michael Grace. Michael is an honorary West Virginian who was born in a WVU hospital just over the line in Fayette County, Pennsylvania. That's part of the Benedum service area as well, but we count that as part of the Mountaineer family. He's the first generation college student, and has moved through that beginning to now run not only the biggest healthcare system provider in the state of West Virginia, but the biggest employer in the state of West Virginia. And he came on board right at the cusp of when we were experiencing huge growth in past pandemic. We were moving through the pandemic, massive growth in how we were thinking about the healthcare system. And I had the privilege at that moment in time to work with the WVU medicine team and was in a lot of the WVU medicine leadership meetings when Michael's position was open. And I can tell you firsthand the excitement about Michael's coming to the health system and what he was going to bring. So thank you, Michael. Let me also make a special note of welcome to our true blue actual mountaineer born in the boundaries of the state of West Virginia, Scott Raynes. Scott has been here for 7 whole weeks on the job managing as president and CEO of the Marshall Health System. So we are eternally grateful for you to make time as you come back. But Scott had been a health leader and an executive all around the country, and most recently in Georgia before coming back. And so the idea of looking with fresh eyes at the culture that Scott knows very well and was part of in growing up, but also looking at what works and what we might think about in other rural areas, including Georgia. We think of Atlanta or some of the big cities, but it's not all that way. And the other states is really going to help you to bring back some of those great ideas to all of us. And we are thankful again that you're here back home in West Virginia, a mountaineer by birth and by choice.
Thank you.
Thank you, and welcome, Scott.
Thank you.
And David Ramsey, who is an absolute seasoned professional. Okay. Is that better? Okay, thank you. All right. So we're going to move to, hopefully you heard a little bit about our first 2 speakers. The last speaker here, but certainly not least, is a seasoned executive who has really not only been a health leader in many states before West Virginia, but for the last quarter of a century, 25 years, has managed the CAMC system, and now what he's going to tell us about Vandalia, the Vandalia health system. And these folks are not just really experts in their fields. You know, I will say, Michael, I bring my parents to WVU for specialty care. Scott, when my soccer player has gotten hurt, I head on over to Marshall Health. And as Dave knows, I delivered my babies in his hospital. So this is something that matters, again, to all of us. Let me tee up the first question for all of you to talk again about what is a healthcare system? How does it matter to us when we think about longevity? And what kinds of things are you doing to innovate and bring together healthcare system services and our idea of a long, healthy lifespan?
Okay. Good morning, everybody. It's a pleasure to be here, and thank you for this opportunity. The Vandalia Health System is now 17 hospitals across the state. Let's set that aside for a moment. We're actually the 2nd largest employer in the state. But set that aside and let's think about health. Health systems, it's been postulated and based on what you heard earlier from Dr. Marsh, health systems, they say, only contribute about 35% to your health. That the rest of it is all the things we heard earlier. Do you feel safe at home? Are you raised by your parents? Do you have air conditioning? Do you have heating? Do you have electricity? Do you have clean water? All those stresses that shorten your life are the things. What are your genetics? What are your life choices? Do you smoke? Do you wear a seatbelt? Do you do other things we all know we shouldn't be doing? And so, health systems are there to take care of people, but when you really think about us, we're there to keep people healthy that choose to come to us for those services. And then we're there to keep people healthy that have chronic diseases or a chronic condition of some kind that we try to help. So, that's what health systems do, in my opinion. We try to be there for really everybody that needs our services in an emergency and a trauma in an effort to try and keep themselves healthy and well. But that's an individual decision. We can't force people to come to us. So that's how I see the health system.
Yeah, I would echo what David said, and let me start by saying thank you, Rocky, for your graciousness and hospitality. It's been a pleasure in my brief 7 weeks here to be able to engage with you. Thanks to the foundation, Benetton Foundation, for all that you do. I've been a fan and watched it from afar, and of course grew up as a part of the resident of the state, and know your contributions are immense and difference-making. What rich conversation we've already had this morning between Dr. Marsh, who's let us guys know we better be taking care of our wives, to Nancy and her comments and data, and then of course, to follow up with Senator Capito. What a rich, robust conversation already. To piggyback on what Dave has said, we really are an entity of systems throughout this state that are here to meet the state's needs. Typically, it's more reactionary than we would like. We tend to be the catch-all of the problems as opposed to being able to contribute as much as we might like to prevent and prolong. I think that is changing. I think we see change happening in that space and in that place, and it's gradually happening over time, but in a very episodical, slow way for a variety of different reasons. But I'd take another little slant as to who and what we are as well. While we are dependent upon to be the care provider for our communities that we serve, we also are an economic engine. We're an employer. Imagine your community without your health system nearby. Imagine what your quality of life would be without your health system nearby. Imagine if we did not exist or did not exist in the way that we do today, particularly in West Virginia, which is a little bit different than the other states that I've been in, quite candidly. We are robust. We are sticky to one another in many, many ways in the areas that we serve. And we are here to really react and respond to our patients and families' needs. Once again, largely later than we would like to be able to do so, but absolutely necessarily so.
Those are well-said comments. On behalf of Albert Wright and our entire health system, welcome. It's a pleasure to be here. I would define a health system as a conglomerate of people and entities that exist to do two things: provide care and to improve health. WVU Health System, it's an academic medical center. We have a two-part mission. The mission to, improve the health trajectory of the state of West Virginia and all we serve, but also an educational mission in training the next generation of healthcare professionals. We are a 25 hospital system, over 3,000 physicians and other providers, but importantly, we exist to serve all of you, at times of need, but more importantly, to be innovative and start thinking about how we emphasize the health component of that word healthcare instead of care. That's a difficult thing to do in today's environment. The incentive system that exists in the American healthcare system today rewards providers to do more volume instead of emphasizing keeping people healthy. And you asked Rocky about innovation. We believe the creation of peak health over time will help us emphasize the health component of the word healthcare and to do things to keep our state, our people healthy. So it's a journey, and we're committed to going there in support of all of you. And we look forward to your partnership as we move through a new era of healthcare as we focus on health instead of the word care.
Great. Well, so we've now heard meet people where they are, understand the culture, understand what people will do to access that care and what they need, understand the workforce issue, not just what the hospital systems contribute, but
Right.
what you need to be able to manage that care and deliver it where and when people need it, and to be able to think in terms of what does the payer landscape look like and what does innovation look like, right? I think, is that fair, where we really are kind of crystallizing? And I bet these are conversations that you're having in your kitchen table conversations and with your family members. How do I get to the doctor, or how do I get, my dad's 76, and he says, you know what, I've outlived, Clay Marsh, the zip code, I've outlived my zip code age, so You know, what else? I'm on the right side of the daisies for the moment. What else should I be doing? That's a culture issue we need to think about. The
Right.
workforce issue, all of those of you who raised your hand and said you're in education or in higher education, or you're a parent, Brandon, right? What do we tell our kids about healthcare jobs? Because it's probably a challenge to recruit and retain professionals in a rural environment. And we should also think about growing our own, right? So how do we talk about those folks with encouraging the pipeline, holding hands across the entire ecosystem of our education system? And for the payers and the innovation, we know that whether it's innovations like PEAK or Medicaid or Medicare, that people sit around and think about, how do I sort through, as Senator Capito was saying, her parents' finances as she's becoming a caregiver? How do we think about the piles of those explanation of benefits that you get after you go to the doctors? Those are all things that we in our everyday lives are thinking about. But the disruptions and the challenges that we're seeing, the changes in healthcare system and delivery, also really make this a moment in time for us to really examine those differently. So I'd ask another round here. Tell us, and let's have this conversation last. This is one of those takeaways we can talk about and come back to. Tell us your thoughts about how we can have those kitchen table conversations or in our professional lives improve how our cultural inclinations may make us really need to think differently about how we lean into health and how we make sure that we're doing everything we can for a robust, educated and trained workforce, and we're continuing to innovate so people can have affordable care.
I'll let one of the other gentlemen start this one.
I'm happy to. I'll start with workforce development and just the sheer aspect of education. While, through our School of Medicine, we are working to produce our next generation of physicians, and that's true across many institutions throughout the state. We need more of that. But we also are faced with, nationally and especially in the state of West Virginia, a workforce shortage. Typically when that's stated, we automatically think we have a shortage of nurses. While that is so very true, we have a shortage of a lot of issues within the health system. So we need to grow our own, and typically and historically, what's been done is we've all been partners to higher education to develop that workforce, and that's got us this far. But now we are finding the need, and it's, again, a national phenomenon, to penetrate into secondary schools, to generate interest in the healthcare field, to create avenues for that future worker, that future employee to come our way, whether it be through the university systems, whether it be the technical colleges, whether it be through our own programs that we grow our own. St. Mary's School of Nursing, the oldest in the state, nearly 100 years old, is an example of that. So when we think about those future needs, and then as Senator Capito said, the need for having caregivers at home, and how can we better educate and improve quality of life in that space, because it's very likely those needs can't be met through traditional avenues. We have to give a little bit of thought and be creative as to what do we do about the future workforce when we think about longevity. I would say to you, great things are beginning to occur, more things need to occur as we open our minds to what that might look like.
Yeah. I'll touch on two things that Rocky had talked about. One, how confusing the healthcare system is to everybody, including myself sometimes, and in my family, those dinner conversations you all may have. And secondly, the workforce component. It's an extremely difficult industry to navigate. Co-insurance, co-pay, deductibles, those type of things. You get things in your mail, you don't know whether it's a bill or an explanation of benefits, what's an EOB, those type of things. And, it's really important that people like me understand that the common person is receiving these things on the other end, and that we work to simplify healthcare for everybody. And that is what we're attempting to do with interoperability across our network. Everyone's on Epic, our Peak Health Plan is on Epic, and we're trying to simplify healthcare for the common person. It's okay to ask for help. I will tell you personal experience, I get home from work many days and my wife will throw something at me and she says, "What's this?" And it says Peak Health across the top of it. So, we're not quite there yet, but we're working to get there. So it's okay to ask for help. It's okay to call those customer service numbers. It's okay to, message people like me, when you need help. And my promise to you is I will always get back to you. The second part is the workforce component. And I would implore all of you and your families to understand that a job in healthcare is an extremely rewarding job. And you don't need to go to a 4-year college to get a great paying job and a very rewarding job in healthcare. There are technician positions, that are available. We at W Medicine have created our own nursing school where, and things like the Aspiring Nurse Program, where we understand that, it's difficult to go to college. Some people can't afford it. I'm not ashamed that Rocky mentioned I'm a first-generation college student. I had to somehow, some way, find a way to pay for college. I did that. It would have been very helpful if there were things like the Aspiring Nurse Program or, our own nursing school that we developed to help people who need financial assistance, to get through college. But W Medicine, especially WVU Hospitals, which I have the honor and privilege of leading, we've created our own programs. We have a surgical technician training program where, we're training our own, and we actually pay for that for, individuals who want to go through that program. We have an X-ray technician school. And to these gentlemen's good point, to Scott's great point, I should mention the shortage. It's not just nurses, folks. It's a lot of different things. And there's a lot of good jobs out there for people who choose to get into healthcare that aren't necessarily doctors, nurses, people like the three of us that your family's members can capitalize on.
Yeah, we're all three of us are teaching hospitals, and we all have thousands of learners walking through the halls of our hospitals every day. But in my opinion, the biggest issue across the state, and pretty much every state, and every kitchen table, is access.
Yes.
When you go into rural communities, or even in Charleston, where our medical center is located, or here at Mon Medical Center, for example, in Morgantown, access is the issue. How soon can I get a doctor's appointment? How soon can I get in to see? We just went through a legislative session where a lot of legislators feel that healthcare and CON, Certificate of Need, that allows you to build hospitals and provide diagnostic services and those kind of things in our state, isn't about that. It's about access. I can't get a doctor's appointment. If we eliminate CON, for example, we're going to have all these doctors all over the state. Well, it's not true. It's not going to happen. It's not going to change anything materially. When we go into rural communities, especially small communities, but it's the case in our larger communities as well, in medical center environments, the first thing we hear is, I can't get in to see a specialist. So our organization, and we're all doing very similar things, is we spend a lot of time focusing on taking care to those communities.
Yes.
Half of the babies delivered in our state are Medicaid babies. Half of the kids that are insured in our state are Medicaid children, are insured by Medicaid. So they don't have the resources necessarily to come to us, so we have to figure out how to go to them. We did this past year about 400,000 telemedicine visits. We have telemedicine hubs around the state where individuals can come to a clinic and see a specialist, a subspecialist via telemedicine. We have mobile mammography that goes into the communities. We work with our insurance partners to identify and call people that have not had a mammogram in the last 5 years, or maybe never had one, but are on that insurance plan. Same thing with lung screening. Same thing, we have all these mobile clinic. We have an HIV mobile clinic as well, the Ryan White program. It's all about how do we take that care closer to home, and how do we deliver it in such a way that people can access it as easy as possible. Now, of course, broadband's a problem across the state, but still, we're all trying to figure out that how do we give access to people? I mean, I've talked to friends all over the country, and when they talk about their families, I mean, we've had to take care of our parents, my wife and I, and it's the same thing. I mean, they can't get access where they live. California and Louisiana, Florida, anyway, I think, man, how many people in this audience would say access is the number one issue.
Yeah, Rocky, if I could
Okay.
piggyback just for a moment on that. You know, we spent a little bit of time talking about the workforce of the future to help with longevity and the need to develop it in whatever means and ways that are out there. When we think about access, you know, pre-pandemic, telemedicine was more of a unicorn than a reality. We all talked about it, but we've never really seen it. Post-pandemic, because it forced creativity, now all of a sudden we're seeing hundreds of thousands of telemedicine visits. In the state, again, thank you, Senator Capito, for the ability to have broadband expansion. It creates access points. It's our job to help do that. It's also the payer's job to help us do that because there's a little bit of a riff in that space. And then to Dave's point, we've all got some mobile capabilities to where we can take care and meet people where they are, but there's a limitation to that as well. So a forward focus on how to create access in non-traditional ways that are of quality is pivotal because within Marshall Health, the Marshall Health Network, you know, 3 of our major pillars are rural health, access-based, obesity, diabetes, chronic disease, and gerontology. Well, that typically means folks aren't going to necessarily be able to get in their cars to come to us. We have to get to them. And there's a few different ways that we need to be more creative about building that architecture and that infrastructure to make that happen.
And I'll just add one more point regarding access, because sometimes access is dictated by workforce availability. And I think it's extremely important while we talk about creating new programs and services to widen the funnel of new healthcare professionals, that people like us understand your best new employee is your current dedicated employee. And what are we doing to create workplaces where people feel like they're appreciated, they're valued, they're heard, and that they genuinely want to work? Because there's 2 items that go into the math equation of how well you're staffed as a healthcare facility, right? There's recruitment and there's retention. And I think a lot of facilities spend a lot of time focusing on recruitment and not necessarily do a great job of focusing on retention. And how do we keep our existing people, you know, where they're at in our health system, feeling valued and appreciated and rewarded for the good work that they do. And I think that if we do a better job at that collectively, we'll be able to staff our places better and therefore improve access.
That's great. So really you were able to weave together all of those things. The culture piece is we are not either able or willing in West Virginia because of the topography, because of our socioeconomic situation, because of the distribution of services to always just get in the car and go to where we need. So that really is incumbent upon us to know how that payer system works so we can pay for the care, and how our workforce is and our technology is geared to be able to get the care to the people where they need it for to kind of cross that culture and some of those local challenges. Let me ask, just to clarify for those folks in the audience who are not familiar with some of the things that we've just talked about, to just do one quick lightning round, and then I'm going to do a quick wrap-up question. Michael, you mentioned peak. I'm going to come back to you and ask you to just describe what peak is, why it was an innovation. And Scott, you talked about that workforce and how we get earlier into that pipeline. But you also had shared with me previously that you were born in Beckley, West Virginia, but you had a home where mom was a nurse, you had a whole bunch of people who were in healthcare. Tell us how we can each go home and think about how to catalyze that pipeline. And then when we talk about meeting people where they are, and they're saying, really, it's access, and we're caring for our parents, how is it that we can make sure everybody knows, if you did a map right now of all of the locations where you now exist, it is a really impressive map of locations. Some of those are telemedicine. Some of them are outside of the state. I bet if you put down on your notepad right now a guess on how many locations, including how many states, these 3 gentlemen are serving, we could put that into a bowl and pull out the right answer. I don't know that everybody would get that right answer. I think this may be one of the things that you'll be surprised about is how do we address that. So let me go right through that.
Okay, so I'll start with peak. I'll be a spoiler. W Medicine currently is in 4 states, majority of which, of course, is West Virginia. We're in West Virginia, Pennsylvania, Ohio, and Maryland. Of those 25 hospitals, over 20 of them are in West Virginia. Our main mission and those we serve. Peak Health is an insurance company. We like to think it's a different kind of insurance company. In healthcare, it's an interesting industry in that there's this middleman, right, who collects premium dollars from employers, sometimes individuals, right? It's called the insurance company, and they hold that money and they pay it to hospitals, providers, places like the three of us work and operate. I've often thought in my career, why do you need the middleman, right? Because that middleman, the insurer, is trying to keep the money from the providers and the hospitals and get as much money from the employers and individuals as possible. A lot of these companies are for-profit entities. So Peak Health is our own insurance company. It's not just W Medicine. We have minority owners, Marshall, of which is one of them. And we are trying to create an insurance product that's easy to navigate for the consumer, all of you in the room, but also is aligning incentives between the payers of health, the payer of healthcare services, and the providers. And Albert likes to say, and he and I talk quite a bit, as you might imagine, that each of us are products of our experiences to date and where we've worked in our paths. And Albert and I had the privilege of working at a really forward-thinking organization that had its own health plan. But that health plan was a profit center still, right? So we made Peak Health a cost center. And the difference is when the health insurance company is a profit center, it's motivated to make money too, which would mean keeping money from the hospitals and physicians. When it's a cost center, it's just basically taking the money from the employers and individuals and then funneling it over to the hospitals and other providers, and that's aligning incentives, right? It's basically knowing that Peak Health as an insurance company only has a set amount of dollars to care for a population, and right now I should qualify that we basically serve our own employees in WVU Medicine. We provide administrative services only, and that's too technical for this room, but for a few other entities. But we're mainly a Medicare Advantage insurer right now, which basically means if you have Medicare insurance, you can select Peak Health as an option rather than fee-for-service Medicare, and Peak Health would be your insurer. So the Cliff Notes version is Peak Health is an insurer that's trying to do something a little differently, and we hope to scale it over time, but we really want to make sure we have things right before we go larger scale.
Yeah, Rocky, I would say you're absolutely right. As we talked previously, I'm a native of Fayette County, West Virginia. I'm born and raised just outside of Oak Hill in a little town called Kincaid. And if I took anyone there, if you know where Kincaid's at, clap your hands. Oh my goodness. Well, who knew? I thought the population, nonetheless. I was fortunate to have a mother who worked as a nurse and a family full of providers, doctors and the like. And so that really influenced me early in my career. After I realized I couldn't stay in college forever, what direction did I want to go? And so healthcare became somewhat organically, but unknown at the time, the pathway. And I started with WVU and ultimately, throughout my career, as you've articulated, found my way right back to Marshall Health Network, where I'm thrilled to be. The ability to have those kitchen table conversations and to penetrate secondary schools, but to have that dialogue around the table about what that career in healthcare can look like is one that I would just ask and invite everyone to have the courage to do and be willing to do, because we're more than doctors and nurses. We all, I'm absolutely certain without question today, that Dave Ramsey, and we would hire IT professionals tomorrow if they were on our doorstep. We would hire accountants tomorrow if they were on. We are so diverse and dynamic that we need to think about it holistically and have families think about it holistically, because not only will we be the caregivers to help assure longevity, but we will also be the entities that will assure jobs and the ability to have a very meaningful income. And really, we're not in it to do anything other than to care for others. So I would say it's a very pure, good thing for us to consider and a worthy profession to be a part of. Because in all of our systems, whether we truly are caregivers at the bedside, we are all caregivers to the caregivers and those that need our
That's
health.
great. And we talked earlier, one of those things that we want to think about for longevity is meaningfulness, and that contribution to work at something that matters
That's right.
really fits in there. Let me ask on the, where are we on the map? Talk about Vandalia. What's Vandalia?
Well, I mean, hopefully many in this room know that Vandalia was this region was called the Vandalia Territory when the British ruled the United States. So it's a legacy name. It sort of disappeared after the Revolutionary War. There was some discussion that the name of West Virginia should have been Vandalia back in the day. And so that's where the name comes from. And it's Vandalia Health, focusing on the health component. It's not Vandalia Health System, because we wanted to focus on the health component of it. And these gentlemen have already said this, but together, healthcare in our state is the largest employer now. You have 3 of the largest employers sitting right here across the state. And you can't have health without a job. You cannot, and everybody is entitled to health. And everybody's entitled to a job. Even in our smallest hospitals, they're the largest employer in their community. They're providing an infrastructure. They're providing an opportunity for the community, not just for access of health, not just to manage, hopefully keeping people healthy, but also to give that energy to the community. A community is not going to grow. If a community loses its hospital, it's on the way to die. So talk about the stress of not having a job. Talk about the stress of not having opportunity to go to school, maybe come back to your community and work in a healthcare environment. It's a unique calling for those of us that work in this industry. It gives us all, a reason to get up and come to work every day. I hope that all of our employees feel that way when they get up every morning and they come to work, or they get up every afternoon and they work night shift, or they're working the weekend, that they're coming because they know it's good for their families, they're good for their friends, it's good for their loved ones, and it's good for them personally.
Very good. Well, I know we're coming to a close for this panel. Really appreciate all of the time that you've given to us today. How many people learned something that they didn't know about how to get care in their families or for themselves and where that might be? How many people learned something that they could do to help with the future of those healthcare providers and workforce? All right? And I think importantly, one of the things that we had talked about this morning is that the transactional nature of where we thought a healthcare system had been. You come to a doctor's appointment, you pay, is really not where you're thinking to innovate and structure this moving forward. That idea of public health and all of those social drivers and all of the other pieces that we discussed today that matter to us when we're making choices where our healthy individuals, families, communities are so important is going to drive that public health. So thank you all for all of that you're doing and for your time.
Thank you.
Thank you.
Thank you so much to that wonderful panel of healthcare leaders. It's wonderful to hear and see what you're doing to move the future of healthcare to be better in West Virginia. And Rocky, thank you for the facilitation very much. Well, it is time for lunch. But before we have one more polling question. And these you will rank, these are healthy habits, and you'll rank them in order of importance to you, with most to least important. You can do that now. And then leisurely have a lunch. And the way we'll do the lunch is you just whatever buffet table is nearest you, help yourself to go. It should move quickly because it's on both sides. And what we'll do is we will break and we'll have a nice long lunch until 12:20. And at 12:25, you'll hear our music playing, and we have a busy but exciting afternoon. We'll welcome our sports science coordinator right after lunch from the Pittsburgh Steelers, and then just go on from there. So enjoy your lunch.
Hey now, listen up.